All right, great. So my name is Tana Chongsuwat. Thank you for having me. I am a second-year primary care research fellow as well as a family medicine physician and working towards getting a master in public health. So I'll be talking about cervical cancer health facility assessments that we did in Gulu, Uganda. I have no disclosures. And so to start with, I'll talk about cervical cancer around the world. And so as we know, cervical cancer in the US as well as other developed countries has been pretty well addressed, mostly due to HPV vaccination as well as resources on screening and treatment. Although really when it comes down to it around the world, it's still very much of a problem. And so in many low to middle income countries, there's a very high burden. And the incidence, as you can see in the darkest blue, is really high in sub-Saharan Africa as well as parts of Asia and Central and South America. And it remains the second most common cancer death in women of reproductive age 15 to 44. And so the burden is high, growing, and inequitable. And so on projections for breast and cervical cancer, comparing 1990 to 2010 to 2030, the projections are that the cervical cancer's disparities will continue to grow. And while cervical cancer is in the more developed countries down here, it is something that continues to be addressed and hopefully will continue to have a good curve to it. But in many less developed countries, as we can see, it just continues to exponentially grow and the disparities widen. So for cervical cancer over the lifetime, we know that there are different methods for prevention, primary prevention through vaccination, and then screening and treatment for invasive cancers. And the timeline is broad. And so HPV vaccinations in adolescent as well as young adult, and then development of pre-cancer and cancer, and many points where this can be addressed. Although worldwide, especially in sub-Saharan Africa as well as Gulu, Uganda, that the work is in, co-infections with HIV is still very high. And this timeline progresses really quickly, and women are 6 times more likely to develop cervical cancer. And so in this project, there were 2 objectives. The first one is to determine what resources are available in Gulu, Uganda to provide screening services, to provide services on cervical cancer prevention, screening, and treatment. And then second is to use the assessments to identify gaps for future research and capacity building programming. And so what's being done now? And so right now, the Uganda Ministry of Health has made efforts to address cervical cancer. And so in 2010, they published a strategic plan for a 4-year plan to address 3 priority areas. And so HPV prevention through vaccination, low-cost screening through VIA, visual inspection with acetic acid, and then treatment of early dysplasia using cryotherapy. And so the work that we're doing is in Gulu, Uganda, and it's located in northern Uganda. Some call it the Pearl of Africa because of where it's located in Africa, and it's surrounded by Kenya, Sudan, and then the DRC. The significance with the northern region of Uganda is that the Civil War, and historically there's been a lot of conflict in northern Uganda, and so resources tend to be even lower comparing northern Uganda to the rest of the country. And so as far as talking about health facility assessments, I just want to talk about how they're classified. And so they classify their health facilities based on 1 through 4, and then general, regional, and national referral hospitals. And so we're focused mostly on the Health Center 3s going down. And so Health Center 3s are able to provide outpatient services. They can also provide some inpatient care, laboratory services, and then they have a maternity ward. And then Health Center 4s and above have more subspecialties as well as surgical management. And so then in the Uganda strategic plan, they outlined the expectations. And so for Health Center 3s, they expected facilities to be able to conduct education on cervical cancer, HPV vaccination, as well as performing screening using VIA. And then for Health Center 4s and above, they should be able to provide basic treatment using cryotherapy. And so in Gulu, there are 23 facilities that we targeted. 18 of them were Health Center 3s, and then 5 of them were Health Center 4s and above, which we grouped. And so first we needed to develop the health facility assessments. And so the health facility assessments, they didn't have one particularly on cervical cancer in Uganda. So we actually started off with something called the Harmonized Health Facility Assessment that the WHO developed. And they developed this in the past couple of years, and it was designed to be administered globally to allow for a comparison between countries and health systems. And it includes a pretty wide range of questions and assessments of different services, including cervical cancer. And so we basically took the section out of the Harmonized Health Facility Assessment that addressed cervical cancer. And then we also looked at what the Uganda Ministry of Health already uses. And so they use something called a results-based financing program that's done quarterly. And this results-based financing program analyzes current resources as well as the quality of care of health facilities. And the outcomes then determine how much funding is allotted to facilities based on the services that they have available as well as health outcomes. And literature has shown in the past that this has incentivized provision of services and increased service coverage. One of the downsides with this results-based financing program is it doesn't specify diseases, and so therefore it didn't have information about cervical cancer resources, nor did it have enough questions to be able to extract information on on the ability to provide screening services. And so basically we took these two health facility assessments and combined them to create our health facility assessments. And I'll talk a little bit about our partner organization, and they actually conduct the results-based financing assessment tool, and therefore we're familiar with the format. And so this is kind of a brief of what our final health facility assessment looks like, and we grouped it into 3 different sections, one on what services are available, then the support for quality services such as recent training, and then the materials that they had on hand that were functioning to provide prevention, screening, and treatment. And so looking a little bit on our data collection, so we partnered with Gulu Women's Economic Development Globalization, GWEDGI, that's located in Gulu, Uganda. And they're a partner organization that I've known for many years, although I had not done any direct work with. And so when the pandemic started, I partnered with them to continue some of the work that I was working on previously, and we developed this project. And so we did get local approval by the Ministry of Health's district officer, and then we conducted virtual field training and then subsequently the data collection. And so some of our results show that, so we got results from 21 facilities. 2 facilities refused. One stated it was due to time, and the other one stated they wanted to directly report the results to the district officer, and therefore we don't have that data yet. So overall, we have data from 16 health facilities. 5 of them were health facility 4s and above. And then we analyzed the results. And so in the strategic plan, they outlined screening with VIA only, but then we expanded the screening to include pap smear and HPV testing. And then for treatment, we expanded the treatment options past cryotherapy into thermocoagulation and excisional methods. Particularly HPV testing and thermocoagulation, since the strategic plan was published in 2010, there has been quite a bit of advancement in the availability of these 2 methods. And then we also analyzed the support for public examinations. And so the questions and materials that we asked, particularly whether or not they had speculums, a gooseneck lamp, a gynecological bed with stirrups that were functioning. And so luckily all of our facilities had speculums. We did not actually negatively impact their scoring if they didn't have a lamp, mostly because healthcare workers in those settings usually modify their practice by using either a headlamp, a flashlight, or the light on their phones. And then for gynecological beds, we focused as well on whether or not they had a dedicated bed, particularly because many stated that they had a maternity bed that they used, but that was all the way in the maternity ward and therefore not readily available. And so for the results showed that 62% could provide HPV vaccinations, 67% could provide screening, 13 of those could do VIA, 5 could do pap smear, and that's the conventional method and not the thin prep liquid that we're familiar with, and then 2 could do HPV testing. 33% could provide the treatment with thermocrystallization and LEAP. The LEAP that was functioning, although they didn't have a smoke evacuator, again, I didn't negatively impact them because they could still actually provide that treatment. As far as other support goes, 2 facilities had colposcopes, 3 could do biopsies, but they sent them out, and 2 reported that they could do digital cervicography through modified methods. And then finally, we graded them through an excellent, good, fair, poor system based on what services they could provide based on the level of facility that they were. And these were the results. So about a 50-50 split on facilities that had excellent or good services versus those that scored fair or poor. And so for the next steps, we plan to pair this analysis with a community survey. And so so basically the health facility assessments will tell us whether or not services are adequate or inadequate. And then a community survey, which we are pursuing next, will determine whether or not the community has good understanding, perceptions, or attitudes towards cervical cancer. And then based on that, we're able to determine whether or not where the gaps are. So there's inadequate services or positive attitudes, and then the other way around. As far as limitations go, some of the wording on the facility assessments we didn't really agree with, such as read ATP test. This was misinterpreted. And then we used the same health facility assessment for all levels of facilities. And we also weren't able to address the level of comfort or ability to provide the services. And so one of the studies that's done recently in Uganda in 2021 was published showing that 18% of healthcare workers in Uganda reported they were able to conduct screening, which did not match our results on what resources were available. And then 57% of respondents reported that they relied on outreach from outside organizations for screening. And so that is my final slide. Thank you. We did get funded by the Global Health Institute to perform this research, as well as thanks to the department and my collaborators.
Have 15 seconds over. Just under 8 minutes for question and answer.
Thank you. Yes.
Fascinating. I was wondering if you could explain your community survey that you're planning on doing subsequently. Are you expecting or hoping that the community, that a community more aware of the opportunities, the potential screening and treatments might drive, that demand might drive services? Or what is the relationship of that survey and your recent work?
Yeah, and so that's a great question. The hypothesis, so it's interesting because the health facility assessments, my hypothesis were there were not enough adequate resources. And so, and then, which our results actually showed is about a 50-50 split. And then, so we were hoping to pair this with the community survey to determine which areas that we needed to address first, especially when it comes to programming, whether or not that was community-wide education, or if the community was receptive then to cervical cancer screening and treatment, then focusing more on the health facility assessment and expanding resources that were available.
I really appreciate all the work you've been doing in this area. I was wondering if you could teach me or teach us, to me the elephant in the room is you've been trying to do this work and then a pandemic hit, right? So can one, be iterative in their research and claim that elephant in the room and make adaptations along the way. Like, now with, efforts to expand vaccination rates, like, does this encourage one to start shifting attention to thinking, where are there opportunities to think about HPV vaccination? Or, something that, because this is I don't know what the COVID rates are in this area of Uganda. Can't imagine they're good. So I'm just curious if you had any thoughts about what you've done in research, right?
Yeah, and I don't know if I can complete into that question, but definitely the COVID rates are high and the vaccination rates are still pretty low. In thinking about kind of the approach that I took to this was almost a blessing because I had already planned to actually increase resources and healthcare worker training to provide cancer resource screening and then early treatment. But because of the pandemic, obviously we couldn't do that, and so we took the opportunity to really kind of dive deeper and think about like what are really the gaps and is it actually at the community level and the understanding. And so some of the previous research had showed that there actually was increased desire for screening and understanding, but there's still a heavy amount of stigma associated with cervical cancer, and the perceptions are possibly low, and so the community survey will help guide us. And so really kind of taking a step back and thinking about like what are the community attitudes towards it and seeing if we can actually address it from that angle. I hope that answered your question.
Yeah, thank you so very much for your presentation. I was wondering if the HFA at all accommodated for time or workload, because I'm thinking that just because a professional can provide the services, they may not actually be able to, or is that a plan for future research?
Yeah, so that was our biggest limitation, is that even if these resources are available, whether or not it's actually done is something that we weren't able to determine. So good question.
We have time for one more question if somebody has one.
Thank you.
Okay.